We're here today to talk about actions our government is taking to ensure diabetes patients in British Columbia do not experience a shortage of a drug called semaglutide, commonly known as Ozempic, in an environment where surging demand in some jurisdictions is driving shortages. Ozempic is a drug that will be familiar to many people. It is, of course, the subject of significant social media discussion of what may be the largest advertising campaign for a prescription drug in recent memory. If you watch a basketball game, you see Ozempic superimposed on the basketball court. If you watch a hockey game, you see it on the sideboards. If you're watching TV at all, you're seeing ads for Ozempic, both in Canada and then different ads that you would get through American affiliates received in Canada about the drug. There is a lot of hype about Ozempic. Ozempic is an injectable prescription drug designed to treat type 2 diabetes and contains the active ingredient semaglutide. This isn't the first time, of course, we've been hearing about Ozempic. In January this year, I announced the expansion of coverage for the drug to more people, as long as they obviously meet criteria. It's essentially what we call a second-line treatment covered by pharmacare for patients with type 2 diabetes. At that time, I expressed concern and provided you with information about the number of dispenses of Ozempic, the share of dispenses of Ozempic that go to the US market. At the time, it was around 9% of dispenses in British Columbia at that time. Just to put that in context, the average drug across prescription drugs in BC, the number is 0.4%, so 9% is essentially 20 times or 22 times that. So today, I asked at that time that we review and have surveillance whether those numbers change, what the impact of the ongoing interest in Ozempic in the community would have on those dispenses to the United States. I felt and strongly felt the reason I raised it at the time of expanding pharmacare coverage was to say that this was an issue and this is one that we would be reviewing and, if necessary, taking action on. And today I'm announcing that it is necessary to take some action to ensure that patients in British Columbia get access and continue to have access to Ozempic. We've also been working closely with the drug manufacturer to make sure that patients in British Columbia get access to this drug. What our data shows for January, February is the following. With respect to the dispenses of Ozempic in British Columbia purchased by US residents from pharmacies located in British Columbia, generally dispensed by mail and ordered over the internet. Just to give you an idea, for the months of January and February, 15%, or 15,798 of all the Ozempic dispenses in British Columbia were sold to US residents. And 19% of the 12,816 patients who received the drug by a pharmacy were American residents. Again, this is compared to the typical average of less than 0.5% or 0.4%. As we looked at the numbers further, we found that 15 of the 15,798 dispenses for US residents, 13,197 of them were issued at only 2 BC pharmacies. This represents 88% of the total dispenses to US residents for the months of January and February. We also know that 95% of all the prescriptions for Ozempic issued to US residents were by one or more prescribers who identify themselves as a practitioner in the province of Nova Scotia. This is concerning, and in my view, it has to stop. The purpose of procuring the Ozempic for British Columbia patients is not to turn around and export it right back to the United States. The purpose of procuring Ozempic is to make sure patients in British Columbia and Canada can continue to access it. In BC, as I noted, we provide limited coverage for Ozempic under pharmacare as a second-line therapy for type 2 diabetes patients to help manage blood sugar levels when other drugs are not effective. This medication was created and intended to treat type 2 diabetes. and it is not right now an on-label drug for weight loss, although there is another drug, a sister drug, that's in that category. Recently, obviously, as you know, it has gained a lot of popularity on social media as a medication for weight loss, which is one of its side effects. The drug's popularity on social media and the, I think, almost unprecedented campaign of advertising for the drug is driving a surge in demand and is resulting in shortages of Ozempic, not yet in British Columbia, but in other jurisdictions, including the United States. Currently, we don't have a shortage of Ozempic, but the trend is in that direction, and action is required. On March 18, 2023, Drug Shortages Canada, the website for reporting drug shortages and discontinuations in Canada, indicated a national survey shortage of one formulation or one format of Ozempic. To act against shortages of Ozempic for BC patients, I have ordered the following immediate actions. I'm directing the expedited amendment of the current regulation to limit the sale or dispense of Ozempic to non-Canadian residents. I'm requesting that the BC College of Pharmacists ensure that pharmacies dispensing Ozempic are complying with all clinical dispensing practices. I'm requesting that the BC College of Physicians and Surgeons ensure physicians prescribing Ozempic are complying with the approved indication of the drug and they meet all clinical practice requirements for prescribing. I'm requesting that the Nova Scotia College of Physicians and Surgeons initiate an investigation into the exceptionally high number of out-of-province prescriptions for Ozempic emanating from Nova Scotia practitioners for dispense in British Columbia, and to take action to address what I view as an unacceptable situation. I'm requesting that the Federal Minister of Health, the Honourable Jean-Yves Duclos, review the Food and Drug Regulation under the Food and Drug Act in collaboration with provincial health ministers to address the concerning number of Ozempic prescriptions emanating from practitioners in one province, and take action to ensure and to protect the supply of drugs such as Ozempic for Canadians. I trust that our federal and provincial partners will support British Columbia in looking into this very serious issue and doing what is necessary to protect the Canadian supply of the drug.